In this presentation, I'm going to talk about the strength of recommendation. So we use the taxonomy called the strength of recommendation taxonomy. It's also known as SORT, S-O-R-T, SORT. This is developed in 2004, and the purpose of the SORT was to allow authors to evaluate the total strength of recommendation for all the articles that you used in a group of studies for a CAT specifically. If you look at published critical analysis topics papers, you'll see that there's a section on strength recommendation, and typically it'll say that the strength of recommendation is A, B, or C. So what is A, B, and C? A articles and B article levels A and B are associated with patient-oriented evidence, and level C is not. I want to show on the screen this article that I have in the class. It explains why this was developed, this SORT was developed, and what we're going to get to is this page on how you actually grade the strength of recommendations. Okay, so let me go back to our PowerPoint presentation. So just a reminder, patient-oriented outcomes. These are things that matter to the patient and help them live longer and better lives. So some things: reduce morbidity, reduce mortality, symptoms improvements, improve quality of life, lower cost. So that's in the study. Did the research, was it a patient-oriented outcome? Most of our research could be this. It could also be if it would change the clinical practice, it becomes patient-oriented evidence that matters. Is the level of evidence that we're doing, does it going to actually change the way that we practice our medicine? Does it change the way we practice athletic training? Then it becomes at a little bit higher level. Whereas disease-oriented outcomes, these are the things that may or may not reflect improvements in patient outcomes. For example, blood sugar, blood pressure, respiratory flow. So this strength recommendation, we see it here, and it, looks the same as here, but I'm going to use this one. I'm going to use back and forth. So recommendations should be based on the highest quality evidence available. For example, vitamin E was found in some cohort studies, level 2 quality, that's level of evidence, to have a benefit for cardiovascular protection, but good quality randomized trials, level 1, have not confirmed this evidence. Therefore, it is preferable to base clinical recommendation on manuscript on the level 1 studies versus level 2. Okay, so strength of recommendation A, B, and C. A, recommendation based on consistent and good quality patient-oriented evidence. What's the little asterisk right there mean? Patient-oriented evidence measures outcomes that matter to patients that we just talked about, okay? So consistently good quality evidence. B, what's recommendation based on inconsistent or limited quality patient-oriented evidence. And recommendation C, recommended based on consensus, usual practice, opinion, disease-oriented outcome, or case series for studies of diagnosis, treatment, and prevention and screening. Okay. Use the following table to determine whether a study measuring patient-oriented outcome is of good or limited quality and whether the results are consistent or inconsistent between studies. Okay, so study quality, level 1, that would be level of evidence. Level 2, level of evidence. Level 3, level of evidence. Okay, good quality patient-oriented evidence. We have the difference of diagnosis, treatment, prevention, screening, and prognosis. So, consistent. Do we have the consistent information across all our studies. So that would be an A. If all our outcomes or the findings from the research of the articles that you are finding have consistent and they're good quality designs, that would be an A. If they have recommendation based on inconsistent, what's inconsistent? Considerable variation among study findings or lack of coherence, or if high quality and up-to-date systematic reviews or meta-analysis exist, they do not find consistent evidence in favor of the recommendation. That's what a B is. A C, we have some clinical practice. Most of the articles that we're going to be using for our paper or our assignment is not going to be a C level because we're not using these types of articles. It should be an A or B recommendation. So in the assignment this week, where you write up the strength of recommendation, you would say that the strength of recommendation based on the 3 to 4 articles used for the critical analysis topic paper is B. And the reason why you would cite this particular article to support why that was A or B level on sort.